You've made the decision to have weight loss surgery, and now you find out you need to follow the liver shrinking diet first. Coming up, let's reduce your stress by talking about what the liver shrinking diet is and why you may need it.
ProCare Health offers easy and affordable solutions with once-daily multivitamins, including our new DS and SADI surgery formula, increased iron, A, D, E, and K. Still just one capsule a day. Visit ProCareNow.com and use code Susan60 to get a free bag of protein powder with $60 purchase.
Hi, I'm registered dietitian nutritionist Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast, episode number 92. I'm here to help you cut through health hype, give you accurate, evidence-based nutrition information worthy of your time and all your effort. Simple, step-by-step strategies that can change your life today. I want you to feel well. Get out there. Do the things you want to do. Live your best life. This podcast is for you. Today, I want to give a shout out to Christina, who said, I listened to all your podcasts and it has helped me so much. I sought out podcasts and found yours, and it's changed my life. Thank you for all you do. Christina, receiving wonderful comments like yours and getting to know people like you, that's what makes my work a joy every single day. Thank you. Okay, so you've made a huge decision. You're going to have bariatric surgery. Then you find out it's not quite that simple. There are numerous steps needed prior to the surgery itself. And one of those steps may be to follow the liver shrinking or liver reduction diet. Same thing, just different names. What the heck is this all about? In our Science 101 today, let's start with non-alcoholic fatty liver disease. And you will see it and hear it abbreviated as NAFLD. 1/3 or more of you considering weight loss surgery may find out you have it. So what exactly is going on in the body? Well, extra abdominal fat is tied to an enlarged liver, and that's referred to as fatty liver. The liver has increased in size, and it may not function normally due to fat cells which have accumulated in it and around it. A fatty liver can increase the chance that you have complications during surgery. So this extra abdominal fat, which often results in this enlarged fatty liver, can make the organ difficult to get around, to move during surgery. Having a smaller liver will make it easier for your surgeon. Well, how is all of this tied to the liver shrinking diet? When you follow this diet, your body uses up the stored carbohydrate called glycogen from your liver. And using the glycogen in the liver causes your liver to shrink. So it's easier to move during your surgical procedure and get to the stomach. So the liver shrinking diet is prescribed to manage NAFLD with the short-term benefits to you of weight loss, reduction in liver size, better access to the stomach during surgery, and then less risk for complications after surgery. Okay, so you're thinking, well, I can do this if I need to. Yes, you can. What does the liver shrinking or liver reduction diet consist of? What would you have to do? Well, typically, it's a 2 to 4 week pre-surgery diet that is quite low in calories. I'm talking 800 to 1,000 a day, though some people, bariatric surgery centers go lower, down to 500 calories a day or so. I'm not a big fan of reducing calories down to 500. The liver shrinking diet is also low fat and low carbs. Okay, so we've got low calories, low fat, low carbs. What does that mean it's high in then? You know, right, it's high in protein. So each bariatric surgical center protocol and their criteria for the liver shrinking diet may vary just a little. For example, some are going to suggest a 2-week diet, while others want you to do it for 4 weeks. Some use liquids only, such as the protein meal replacement shakes that are so popular. but they have to be made with high quality, complete protein. Okay, let's just take a minute here. High quality, complete protein. Breathe. Remember what that means? Remind me and remind yourself. What is complete protein? You got it. Complete protein contains all of the essential amino acids needed by the body. The highest quality protein is found in animal-based sources or soy. Now, if you're thinking, oh gosh, I've forgotten this, if you need a refresher, just go back and listen to podcast number 48. It's called, Is Pea Protein a Smart Choice After Bariatric Surgery? Yes, it's going to talk about pea protein, but it also explains protein and protein quality, including complete versus incomplete. So it's a big deal, especially when you're going to cut calories this low. So protein in the liver shrinking diet is important, and that it's got to be super high quality, complete protein, and it's going to help preserve your lean muscle. Now, additionally, vitamin and mineral supplements will likely be started if you haven't already started them, and may be particular to bariatric surgery outcomes or the special supplements that are needed after surgery. So another option, or second option for this diet, is to only liquids. So first we just said liquids, is a mixture of meal replacement shakes, so liquids, and some food, while yet other facilities will use a third option, and that's a diet of real food only and restricted amounts. Remember how much? About 800 to 1,000 calories per day or less. So again, there are three options you may come across: the liquid only, liquid and some food, or all food with those calories, 800 or so a day. My favorite is, which one do you think? Yes, you know me. I'm all about real food. So I prefer to see this diet be 800 calories or so of real food with the inclusion of low starch, or the same thing means low carb veggies like broccoli, asparagus, and many others like that. And then, of course, don't forget, what else am I going to say that you need? You know, what else do you need every single day? You got that right. Liquids, about 2 liters or 64 to 67 ounces every single day while you're doing this. And you're going to be doing this later anyway with liquids. But since this diet is so restrictive, I feel it's really important for you to be under the care of your healthcare team, particularly a dietitian, while you're following it. All right, let's go back and review 3 things I want you to think about if you are advised to start this diet. Number 1, ask, what type of liver shrinking diet do they prescribe? Is it liquids only, liquids and food, or food only, and for how long? 2 weeks, 4 weeks? And will they provide you with a custom meal plan and specific information to follow during that time? Number 2, do you have diabetes? High blood pressure? Both? Are you taking medications for these conditions? If you're saying to me, yes, I am, Dr. Susan, yes, I am, then tell your healthcare team so that a plan can be put in place to keep you stable while you're following this diet. In fact, you may want to check your blood glucose and your blood pressure more frequently while you're on this particular diet. And number 3, be aware, constipation can be a problem. So talk about this up front with the dietitian or your healthcare team. No need to be put on a special diet and then get constipated. You don't need that. There may be specific suggestions for what you can and cannot take since surgery is coming up. Okay, I know this is very specific diet, and it may seem like just one more thing you must do. But remember, if it is prescribed to you, it will be short term and then done. So it's like one and done. And it's to help you get a better surgical outcome. And remember, that's because you're worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.